Hi, this is Dr. Lee from Integrative Solutions for an Ankle. Today I want to share a pretty cool case study with you guys. I had an honor and privilege to treat this 7-year-old kid for the past 1 month. He originally came to see me 1 month ago with his parents for flat foot, which means that you don't have any arch on the foot, as well as in-toe walking, which means that you're walking inside here like this. This is actually a pretty common problem amongst children that I see. And it's actually a pretty dangerous and significant problem because it increases trip and fall hazard, which means that you have more likelihood to trip and then injure yourself by falling, such as your knees and your leg. It also is one of those conditions, unless a doctor go and then change onto the patient's condition itself, it's one of those conditions that are less likely to resolve by itself. So it's important to detect this problem early on and address it with an appropriate medical professional. So, as I said, I have been seeing him for the past about 4 weeks and we're about 80% better. So, when he first came to see me, he had a pretty significant problem onto his hip, as well as his low back, also on his leg, and also on his both ankles. So what we have been doing was we have been working on his joint mobility, which means that bone movement on all those areas that I had just mentioned. Also, we have been addressing some of the stiff muscles, some of the muscles that are kind of hard, that has been caused by in-toe walking or an unnatural walking using his both of legs and thigh for the past 7 years. Also, we have dispensed a custom foot orthotics for his conditions, for his flat foot as well as in-toe walking, so that he's able to have more of normal foot shape, so he's able to have more of the support as he's walking. So, as we have worked on him for the past 4 weeks, he's about 80% better. But even so, you'll be able to see today that he is still improving before and after treatments. I want to make this video today because I want to be able to show you guys exactly what I would do for typical flat foot with in-toe walking problems, and then how I actually approach this problem with the overall body in mind. One thing that you'll notice is that your foot problem is more than your foot problem, including this case. So when you have in-toe walking with a flat foot, you have a tendency of making some kind of more loadings or creating more problems to your knees and your low back or your hips. Because as you're walking, you're not only using your foot and ankle, but you're using your entire body to make the walk. So you'll be able to see exactly what I'm talking about. So check it out. Relax. No, a little bit more. Suavito. There we go. There we go. Relax. Okay. Suavito, papi. Suavito. Suavito. Relax. Relax more. There we go. Muy good. There we go. Left is before, right is after. After treatment, he's clearly able to move his hip more effectively, so this is also helping him to walk more out-toe. Also, after treatment, he's able to bend his knees more, which is also helping him to walk more straight. And this is also one of the key factor. This is his custom foot orthotics that I have prescribed and casted for him. This has helped to restore his arch. So this is him walking with custom foot orthotics. Like I said, he's about 80% better, so there's still some work to do. But because we have been approaching his problem with overall body approach, so his foot is working in unison with his knees and his hip and his low back, so he can walk much better. So as you guys have seen, when you have flat foot problem with in-toe walking or out-toe walking for that matter, you are treating more than your foot and ankle. In fact, to completely treat the problem, you have to also address all the areas or joints that you're using when you're walking, such as your knees, your hips, your low back, and then your leg muscles. In this way, you're actually addressing more than the foot problems, but the actual walking pattern, so you're able to make changes to the entire body. Alright, thank you very much for watching the video today. If you have liked, please press the subscribe video and then check out more videos to come. Thank you very much. Take care. Be well.